The entire month it was designed to basically be a resource to our patient community. However, Louisa will also share a slide on this. It does not replace the professional healthcare treatment that you would be getting from your therapist, from your doctors. We're just here to give you information so that it's a refresher for you. It'll be inspiring to you. It'll maybe give you different perspectives on the same thing, just so that you can, feel empowered and better perform the self-management activities. But that's a very huge disclaimer. Please do not use these videos as a replacement for any of the professional care that you should be receiving. So thank you so much. So with that, Louisa, thank you.
Okay, thank you, Jeanette. Thank you so much. Okay, so I'm assuming we're going to kind of talk through this, correct?
Yes.
Okay, all right. And there I am. And this is the disclaimer that Jeanette was so kindly able to discuss a little bit about not substituting proper health care for this tool. And these are the pathways. And as you notice, I'm showing my hands is the fatty pad of my hands as I'm working, so the fingers. And we're working right now in the clavicular fossa. And those are stationary circles. They're not complete circles. They're probably 1/2 to 3/4 circles. And the pressure that I'm using there is probably about 1 pound to maybe 1.5 pounds. And I'm getting back to back by the scapula, the spine of the scapula. That's another watershed. I'm using about 5 to 7 strokes in each area. Some areas you'll probably use more than others. And this is deep breathing. So a good way to do that is put your hands on your abdomen and really feel your stomach rise and fall. So you breathe in and relax as you blow out. This is really important for getting your thoracic duct, which is a major muscle for major lymph vessel for draining. And now we're stimulating the inguinal lymph nodes. Those are right in the crease between your leg and your abdomen. So almost to the middle inner thigh there. And again, those are stationary circles. And then we're going to start to open up our pathway from the left armpit down to those inguinal lymph nodes that we just opened up. Amount of pressure I'm using there is probably about 2 to 3 pounds. Some areas, again, you'll probably put a little bit more pressure. And when I mean 2 to 3 pounds, I mean that's the total of your whole hand. So all your fingers, just the fatty pads. And we want to really get up into that armpit where there's a lot of swelling in that lateral chest wall. Okay, so next we're going to open up our axillary pathway on our non-affected arm, again, using stationary circles. And I like to get right in that armpit, and then I might even go even a little bit lower under the breast. Now we're making that pathway. So we start about halfway and then work our way back to the area we just opened up, from the most swollen side to the non-affected side. Again, we're doing about 5 to 7 repetitions. And we're looking for a stretch of the skin. Now, typically you would not be wearing a garment. It's better to have your hand on skin, but for this demonstration, we're using this great garment given to us by Wear Ease, which is a compression garment. Now I'm working up the outside of my arm. This is my affected arm. So we're going to work up the outside 5 to 7 repetitions, doing those stationary circles. And you want to get all the way to the top of the shoulder there. And if you go just a nice slow cadence. Okay, so now we're going to work from the inner arm to the outside of the arm. And as you can see, I've got this really kind of pad underneath my armpit. And so we're working from the inside of the arm to the outside of the arm, like we're making that fluid. Just imagine it going from the inside to the outside, draining it away from the armpit, where it typically drains. Now, the inside of your elbow, that's another area I like to stimulate. Some of you may notice that you pool a little bit of fluid there. So I like to take a few extra seconds and stimulate that inner elbow. And then we're going to go to the outer elbow, that little condyle, and do the same thing. About 5 to 7 repetitions. And if you notice, I'm just trying to get a little bit of skin stretch. Now I like to work the outside of the arm. So from my wrist down, and as you notice, the parts of my hand that is actually making contact with the skin are just the fatty pads. I'm not digging in or using my fingernails. And for some people, you'll probably use a little bit more pressure in this area if you feel like you're collecting a lot of fluid there, or you have a lot of protein buildup, which creates that fibrosis. But if it's pretty fleshy, you'll use just enough pressure to get that skin to stretch. So there's an active phase and a passive phase. So the active phase is when you're making that circle and then you want to release and let that skin retract. Now I'm working the back side of my hand, doing the same thing, stationary circles. Nice slow cadence. Some people have a little bit more swelling in their hands, so you might put a little bit more pressure there to get that skin to stretch. Now you can do each individual finger with the same stationary circle, or you can just do all the fingers like what I'm demonstrating here. But this area that's I'm stimulating right now between the thumb and the fingers, that tends to be kind of a problematic area for some people. So I do like to spend a little time there as well. Now we're going to go from the inner arm. And again, those stationary circles, we're working from the inside to the outside, following that direction of flow. Five to 7 repetitions. And I'm holding my arm up at home. You might just want to sit in a very relaxed place. Not exactly the most relaxing position, but for the demonstration, I wanted to make sure you could see as much of my arm closed up as possible. And I'm coming right back up the back side of my arm where we started. Five to 7 repetitions. Sometimes you'll use a few more repetitions in areas where there's a little bit more swelling. Okay. So now we're going to flush. So we're going to go back and move that fluid from the affected side to the unaffected side. So if you notice, we're doing everything sort of backwards from where we started. We're going back and we're retracing. Five to 7 repetitions. You can do more if you feel like you have a lot more fluid that's built up there. Okay, and then now we're going to drain from that armpit all the way back down to the inguinal lymph nodes. And I like to get right over that breast. A lot of people are pooling a lot of fluid in their breast and right in that side of their chest wall. Now, if you can't do your left arm on your left side, you can take your right arm and you can certainly cross over and use your opposite arm or both arms if you need to. Okay, and then we're going to finish by going back to the stationary circles right in that little fossa, that little hole in your shoulders there. 5 to 7 repetitions. And that's it.
Thank you so much, Louisa. There's a question that came in. Is it better to be sitting or to stand or lying flat?
Well, personally, I did this demonstration standing and sitting so that everybody could see me, but trying to find a nice relaxed area to do it is probably ideal. Most of my patients either do it lying in bed or reclined. Do you have any thoughts about that, Jeanette?
Yes, I think that, the most important thing is that patients find a way to incorporate self-MLD into your routine. So if for some reason standing was your only option for whatever reason, let's say you just, were not able to find a place where you can lie down and sit comfortable or sit comfortably, excuse me, then I say do it in standing. But basically, whenever you have a choice, being more comfortable is definitely better. And when you have the choice, just taking gravity out of the equation is better too. So if you're lying flat with your arm propped up on a pillow to feel supported, and it allows you to have access to it, that's great, because if you can just set yourself up where you have minimal barriers working against you, that would just be better.
Right.
But certainly comfort is important, and getting rid of gravity whenever possible is great. But if not, your forces on your skin will counteract the forces of gravity. So that's...
Yes, well said. And you can do deep breathing anywhere, anytime, at the stoplight, at the grocery store. The deep breathing has so many benefits. And so we decided to put up a little diagram that if you did have a caregiver available, how you could actually access the back side of your body, or the person involved with has lymphedema, is if you can get to the back, you can also open up those same collateral pathways. So if you can see on the left, that is the diagram that I put up during the MLD sequence, but the one on the right is the backside of the person. So you're still draining to the opposite armpit, and then also down, but you're going to kind of angle down towards the inner leg. So it's not straight down, but it's sort of down and around to the front. Does that make sense? And again, those stationary circles, they're not complete circles. They're about 3/4 circles or half circles. And we're using the fat pads of your fingers. The amount of pressure that you use is anywhere from 1 to 3 pounds, which comes out to about 1 to 1.5 kilograms. And so if anybody has any questions about the drainage of the back side of the left arm, we can take those questions later. I would love to talk about the 2 compression things that I used in the video, and sort of like my little personal opinion of how wonderful they were and when I would use them. So are you able to see me full screen?
Yes, we are.
Okay, so the first garment that I had on is called the Katy T, and I wore it inside out, but there's these little pockets that the swell spot could fit in. So it was staying right in that armpit and the side wall, side chest wall. For that person who is asking about the reconstruction and the swelling, what I did last night is I actually wore this to sleep in. You step into it. I wore it to sleep in, but I used the axillary pad and I put it like this around my breast and into my armpit. I have fibrotic breasts, so I noticed in the morning, the side that I used the compression on, that it was so much looser, not as full. And so I was really excited about that. And it was totally comfortable to sleep in, just very smooth and soft. You can wear this during the day or at night, but for that particular situation with reconstruction, I can't say enough about wearing night compression and getting compression in to the areas where people were pooling fluid. So that's really what I wanted to say about this particular garment. And so this one's made by Wear Ease, the axillary pads, and there's